Hello, and thank you for joining me for this session where we're going to look at ovarian cancer, the myths surrounding it, and hopefully help you with early diagnosis. I'm Victoria Barber, I'm a GP. I'm part of Target Ovarian Cancer's GP Advisory Board, and I'm a passionate GP looking into the early signs of ovarian cancer to help us diagnose it early. In the UK, over 7,000 women per year are diagnosed with ovarian cancer, and 11, unfortunately, will die every single day of the disease. Sadly, 2/3 of women are diagnosed in the later stages, which means that their treatment options and their prognosis are unfortunately limited. Many of these cases and these early deaths are avoidable. If we know the symptoms and we know them very well and we're knowledgeable about adapting these, we can considerably affect people's outcomes. Because as GPs, we're best placed with women because there's widespread ignorance around the symptoms and there's misconceptions, and we're going to have a look at a few of the myths today. According to our recent Pathfinder study done in 2022 this year, we questioned 548 GPs. Now, unfortunately, 81% still think that ovarian cancer is a silent killer. 46% of GPs still think that symptoms only occur in the latter stages. Now, these are misconceptions, unfortunately. Now, thankfully, there was some good news from the Pathfinder study. We are finding that 1/3 of women are diagnosed within a month of presenting to a GP. The earlier we can diagnose people, the better their prognosis is. So let's have a look at a few of the myths that we've found. Myth number 1, ovarian cancer is a silent killer. This is a really dangerous misconception, and it's historical, really, isn't it? And unfortunately, it's got into GP and lay people's vocabulary. But the fact is, it's simply not a silent killer, and there are early signs of the disease. So knowledge and knowledge of these is absolutely paramount. So on to the second myth. All women who are diagnosed with early onset ovarian cancer don't have symptoms. This is, again, not true. 85% of women who are diagnosed even in the early stages will have had at least one symptom in the year before they're actually diagnosed. Unfortunately, women can be misdiagnosed. Now, women over the age of 50 are much more likely to develop ovarian cancer. And in them, their symptoms can be put down to getting older, the menopause, an overactive bladder. For example, IBS, that is the commonest cause of misdiagnosis. And irritable, it just simply does not occur for the first time in the over 50s. So beware the new onset of so-called IBS in the over 50s. It doesn't happen. Beware the sterile urines. Have a look at your MSUs when they come back. It's really important to look at that. So if we have a look at some of the symptoms, you should actually be very, very aware of these. You've got bloating, abdominal or pelvic pain, early satiety, in other words, feeling full up. You've got urinary frequency or urgency. And you can also have other symptoms such as change in bowel habit, unexplained weight loss, loss of appetite, and extreme fatigue. So what you should be doing is think frequency. If you've got more than 12 times a month, you're coming back with symptoms. If they're persistent, those symptoms aren't simply going away. Or if they're new for the person, they've never had these symptoms at all, this is what you should be looking at. This is probably best illustrated by a patient I had called Sally. She was 66, she came to see us, she had recurrent so-called UTIs, but nobody picked up on the fact that her MSUs were coming back and they were actually clear. She then came back with symptoms of abdominal pain, and this was put down to stress and possible IBS, yet she'd never had IBS before. 2 years down the line, she was finally referred, and she was diagnosed ultimately with stage 2 ovarian cancer. Thankfully, she's still alive. But in the UK, 1 woman dies every 2 hours from ovarian cancer. It's not a silent killer, and as GPs, we can make a huge difference to outcomes in these women. If we know the symptoms and we're able to recognise them in women, we can make a huge difference to their outcome. At Target Ovarian Cancer, we are very supportive of GPs and we want to help you with this early diagnosis. And as such, we've got many learning tools on our website, which will help you with your CPD and with your appraisal. Also, the NICE clinical guidance, which goes through early diagnosis and what to do and how to refer people on. So I'd thoroughly recommend having a look at that as well. You can also have a look at the full Pathfinder report, and the link is on the screen here. So thank you very much for listening to us today.